Hello, everybody. Welcome to my YouTube channel, Homeopathy Super Sessions by Dr. Jargos. Today, I'll be doing an important topic written in Hahnemann's Lesser Writings chapter, Observation on the Three Current Methods of Treatment. All the videos on Hahnemann's Lesser Writings had been requested by some students or a person who's interested to know much more about it. And I'm sure all these topics may not have been taken properly in the colleges. So I'm sure this will help all of you to score better in your exams, especially the postgraduate people who are pursuing the MD in homeopathy. Well, in this part one, observation on the three current methods of treatment, it includes three main points as the treatment of the disease has not been yet discovered, namely the treatment of the name, treatment of the symptoms, and treatment of the cause. So out here, basically, there are three important points for the treatment of the disease, that is the treatment of the name, treatment of the symptoms, and treatment of the cause of the disease. So three important points are there which have to be remembered. So now let us see the first point, that is the treatment of the name. It deals with the interchangeable remedies and compound prescriptions. So Dr. Hahnemann says that during his time, whatever system of medicine was in vogue, they gave many remedies, or they gave interchangeable remedies. If one did not work, they gave the next one. The next one did not work, they gave the other one, and so on and so forth, and also compound prescriptions. Whereas wherein not one remedy, but 1, 2, 3, 4, or many remedies were put into a bottle and given to the patient. So in one bottle, you're getting 5 or 6 remedies, and the patient is taking that. That is known as a compound prescription. It is the method since remote times, importance been given to the treatment of the name of the disease. So whichever system of medicine was flourishing during that time, it always give importance to the name of the disease. So if you know the name of the disease, you could give the proper treatment. That is what the old school of medicine claimed. If the patient has got gout, give him sulfuric acid. For rheumatism, give him mercury. And for you, give him cinchona, etc. So according to the name of the disease, the old school of medicine used to treat the patient. Examples are given here. Hence, the mere name of the supposed disease is sufficient to determine the name of the remedy. So in the old school, whatever disease diagnosis is there, that is the name of the disease, would be sufficient to discover or to determine what remedy to give. Well, this type of treatment was a quack's practice. So that is a total of bogus treatment what they were giving, or a quack would give if he would treat the patient in this manner. It was so repulsive as it gave several remedies for each time of the disease. So it was a very repulsive treatment. Why? Because not only one medicine, but many medicines were given in order to cure the disease. Hahnemann has written that this was the plan pursued. If A should not answer, that A, B, from A to Z, they are all remedies. So if A should not answer, try B. And if this will not do, a choice lies among C, D, E, F, and G. I have often found I and K of service. So out here, Dr. Hahnemann says that if a remedy A doesn't work, you give remedy B. If remedy B doesn't work, then you can give remedy C, D, E, F, and G. Some people say that I have found remedy I and K of service. Some people say I have found Z and Q of service, and so on and so forth. So some English physicians recently recommended Q's in preference to all other in the affection. Q is the mother tincture. So you could see how much of controversy is there, how much of different remedies are there, how much of interchangeable or compound remedies are used. Some physicians were the opinion that cinchona often cures ague, whereas another practitioner says that it was not useful at all in ague. So out here, again, another controversy. Some physicians say that to treat malaria, cinchona was useful. Other physicians attacked, saying that cinchona was not at all useful in treating malaria. Some of the practitioners argue with a few emetics in which neither chamomile tea nor the bark in the largest doses was of the greatest service. So some practitioners argued that they could treat malarial fever with emetics, wherein the cinchona bark or the chamomile tea wasn't used. I tried this method in cases where neither of the two latter medicines did good. That is what the chamomile tea or the bark. But the emetics did no good in them. I thought myself of giving sal ammonic, and to my astonishment, the patients recovered. So one physician said that neither chamomile tea nor the bark was useful, nor the emetics was useful, but only sal ammonic was useful. So out here you can see different physicians had different opinions about the treatment of malarial fever, what remedies were useful and what were not. Some say nux vomica was useful in ague. Belladonna is also said to have cured certainly and thoroughly some agues where all other remedies have been fruitless. So some people say belladonna was the drug of choice in which all the other remedies were not of use. Do you not suspect that there may be more than one, that there may be perhaps 20 different kinds of intermittent fever? All of them have been included under one heading, all belonging to a single species, that is the intermittent fever. So therefore, Hahnemann also says that all the different types of fevers have been put under one heading, that is the intermittent fever. Just to combat all with a single remedy was difficult. So therefore, since the number of diseases under one group of disease was much more, it became difficult to combat it with only one single remedy. Whereas each requires its peculiar remedy without thereby deserving to be called capricious or obstinate. So each one of each disease will require a single simple remedy. The practical physician has neither the inclination nor the time to draw such fine distinctions between similar diseases and to assign to each of its appropriate remedies. So there are n number of diseases under a particular heading, so it becomes very difficult for each disease to go into the depths or to go into the detail and to find out the exact remedy for each condition. So this became a Herculean task. So therefore, a simple way was to give the remedy according to the name of the disease. So you blindly give one after another until you hit upon the right one. So what happens? You just blindly giving medicines on a hearsay, saying that this medicine could be useful in treating such a condition. So what are you doing? You're taking a bow and arrow and hitting the arrow in the dark. It may not hit the bullseye. So out here, in a similar fashion, you're blindly giving one remedy after the another until you find the right one. Thus, there arose a long list of simple drugs, that is, interchangeable remedies of succedamus. Succedamus means which follows through or which follows well, which were all without distinction said to be serviceable for one disease. So therefore, what happens? If you blindly give one remedy after another, you'll have a very, very long list of medicines, of interchangeable remedies or remedies which may follow well. And each of the remedies have no distinction or no peculiarities, but they are just given one after another until the right one is found. The physician still thought they were doing the right thing and they're treating the patients rationally. So by this system of blindly giving one medicine after another, the physician thought whatever they were doing it correctly, and they all did the rational system of medicine. While some were guilty of giving compound prescriptions, 3, 4, or 6 ague remedies, 5, 6, or 8 dropsical remedies, all jumbled together. So the physicians of the old school, they were guilty of giving complex prescriptions or compound prescriptions, whereby 2, 3, 4, 5, 6 remedies of the malarial fever were given, or 5, 6, or 8 dropsy remedies, all were given mixed together to the patient. All this was drawn at haphazard from the list, which were recorded in the manuals under the name of intermittent fever, dropsy, and used in practice by the coupling them with some kind of spirit syrup, etc. So all these All these medicines, or rather all the haphazard list of medicines, were recorded in the manual of intermittent fever. So under the manual of intermittent fever, many fevers were there, and along with that, many drugs were there. All there was recorded. And these medicines used to be mixed with some sort of a vehicle like a spirit or a syrup whereby they could dispense it. Thus, if one ingredient did not do good, the other one might be of use. So that is the advantage they thought of a compound mixture, that if one remedy did not work, at least the second, third, or fourth would be useful. Therefore, or henceforth, only one would look so unlearned as to prescribe only one single medicine. So the old school thought that if you would only prescribe one medicine, you would look like a fool or you would be an unlearned physician. No prescription was given that did not contain a hodgepodge of simple drugs. So hodgepodge meaning a mixture. So therefore, prescriptions were given in complex form whereby many remedies were mixed together and given to the patient. So that's all for today. The second part will be coming soon. So please see that also. Thank you.